All right, let's get started as people continue to join us during this webinar. I want to thank you for joining us for this week's cross-industry look at how to safely reopen your business. As a reminder, please ask your questions, put them in the Q&A or the chat feature. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. And we're doing these on behalf of the entire county. So all of your economic development and chamber partners are participating in this so that we can get businesses informed on how to safely reopen and you can ask your questions. At this point, I'm gonna hand it off to Boulder County Public Health to do their update, and then we'll come back and ask questions. Put them in the chat at any point and I'll make sure they're asked during the presentation.
Thanks, Corinne. My name is Jesse Rounds and I apologize for not having my camera up. I'm trying to conserve bandwidth. And thank you everyone for joining us for the weekly update. I think if you want to go to the next slide, Lane, just quickly we'll do a Boulder County case update, some epidemiological updates and details as well, and then get into the health order and mask order and with your questions. So the good news out of the update is that we've seen a steady decline in the number of new cases over the last couple weeks. We're not down to any of our previous lows, but it's good news. Yeah, I think the big news here is that we had very few cases over the last couple days. This data ended on Tuesday. The collection ended on Tuesday. So that's our lowest numbers. And right now we're at, I believe, 8.2 cases per 100,000, which is great. It's very low. And we want to see that trend continue. We are unfortunately continuing to see disparities in our Latinx community. The real issue, and it looks like I may have messed this slide up because the disparities for the Latinx community is an important issue, and we're continuing to see that their population continue to be overburdened with cases, but we're also seeing this shift to higher case rates in our younger population categories. So that's not a great sign either. We are seeing very few hospitalizations, which is great, and our testing regime is really working out. We're now seeing very low positivity rates on testing. Our goal was 5% positivity, and we're now down to 2% positivity. So that's really great. In terms of the update, the statewide mask order was extended for another 30 days, but there were no changes in that update to either the mask order or the public health order. So we're under the same regime we've been for some time. And that means that really the reminder is out there. We need to continue to require masks for all those who enter our businesses. If you can provide alternatives, that's great. We really want them to be able to use online ordering or curbside pickup, that sort of thing, if they're unable to wear a mask. And just a reminder, and there's a link on this, and I think Corinne's been providing it as well. The state mask order comes with guidance, civil rights guidance, that says that businesses do have the right to deny service to those who can't or won't wear a mask. And this is just a reminder, it's been in a lot of our presentations, just it's important for people to recognize the risks associated with their behaviors. It's not saying that any one behavior is inappropriate. It's just saying that when you do some of these riskier behaviors, you just should be aware that your chances are higher and your chances of transmitting are higher. So just be aware of where you're spending your time. And we definitely encourage you to be in those lower risk categories. It's just a safer way to be in the community. And really, I just wanted to, we've had this on in a number of different ways, but what we are able to do with Boulder County Public Health in cooperation with the Chamber is we share information through these webinars and through email conversations and phone conversations. We do, with our county attorneys, we work on interpretations of the orders. Our team does enforcement of the orders. And we work with our epidemiological team to provide information for sick employees or employers who have sick employees, and for outbreak guidance for those employers. And then also, we just want to highlight the resources we have available. CDPHE has covid19.colorado.gov, which has a ton of information broken up by sector. And then our website at Boulder County has a lot of Boulder County specific information. We have access to the artwork and signs that the Boulder Chamber has put together. We've got guidance that's specific to Boulder County. And I think it's just, there's a lot of information out there. Definitely come to us if you have questions. And this is something that came up last week or earlier this week, and in terms of interpretations, it's sort of the latest thing that I've been hearing, and that is that we just want to remind people that if you are participating in a sport outdoors, so this is not covered by the indoor mask order, if you are outdoors participating in a sport, you need to be wearing a mask if you can't maintain 6 feet. And that's really to be in compliance with the Boulder County mask order, which is stricter in that way than the state order. So just be aware that that's something that we've interpreted slightly differently in the past, and I want to get the word out that we're looking at that more strictly now. And then one good update on Protect Our Neighbors. It's hard to read this chart, but the next slide has the story I think that we want to get out there, which is we have now met, last week we had met 4 of the Protect Our Neighbors metrics, partially met 3 and not met 1, and now we're making small progress. And so I think that's a good sign. We're getting closer and closer to the point where we would qualify for Protect Our Neighbors if that's something that the community wants to pursue when it's possible. But it is a good way of measuring our progress against the virus. And that's really it for the presentation. I just want to remind you that as we get more information, as things change, we will update them in this session at 3 p.m. And then right after this, we have a special session this week. It's for landlords. So hopefully that'll be a lot of good information. And then for the just really want to sort of trumpet this, the Spanish language session in collaboration with the Latino Chamber is released on Thursdays. And one of our colleagues records that in advance and tries to address specific questions that have come up in those sessions. So just a really good opportunity, I think, that we should all pursue. And then just please do contact us with questions at covidbiz@bouldercounty.org. And if you have complaints, do use the call center. You can also use the email. The call center, they're a great team that can direct you if there are resources, but they can also pass them on to our business liaison team to deal with any enforcement issues. With that, happy to take questions.
Great. So as everybody knows, I send out the Spanish webinar with the update every week. And this week's Spanish webinar did a little bit more in depth about returning to school and where to check for the rules and requirements that you need to follow when returning to school. So just wanted to give you an update on what this week's Spanish webinar looks like. Speaking of returning to school, Lane or Jesse, what precautions and measures is the county taking for the return of CU students, specifically controlling community spread?
So I think in terms of specific actions, we've been working with the administration at CU to provide education for the students, They have set up their own testing regime for their students. They have quarantine dorms that they're setting up. But we're also working with the Hill community to try and make sure that we're getting out ahead of any of the sort of, regular parties that happen, that sort of thing that happens in the college community. So we're sort of hitting it from as many angles as possible. And I really just want to, highlight that the CU as an institution has been very cooperative in trying to address this. I think we're all trying to get our arms around the best way to do this. And Lane, you've probably been involved in more directly with more of those meetings than I have, so I have more perspective there.
Yeah, Jesse hit a lot of the things we're doing. CU's also doing a mass testing for all those new arrivals. So probably over 7,000 people will get tested here, and some it's already started. Then, as Jesse mentioned, should they identify people that are sick, they've already identified dorm areas, residence halls that will be used for that isolation. We are working on addressing potential parties because we know that that's a high risk. That's really one of the drivers for our next session at 4 o'clock, is to work with all those properties that are rentals through the city and the university, so we can identify all the risk factors, get information out to hopefully do some prevention, but certainly if we have problem facilities, that we have some actions that will be taken. There is an MOU, a memorandum of understanding with CU. So Jesse mentioned they're going to handle the contact tracing and case investigation work for any CU related illnesses, so that they're geared up for that additional capacity. They're done a lot of education and proactive work with the students. There was trainings and information that all students had to go online and be aware of before they even arrived in Boulder. So, and ongoing, again, information that will be shared. So a lot of proactive steps, but also preparing for some reactive enforcement as necessary.
So I put into the chat a link, and I'll send this out in the email, to the CU's tracking dashboard. They're trying to be as transparent as possible. There are limitations to this dashboard, but I thought I'd put that out there, in addition to an article that I'll send out about CU. Another thing that's happening is that CU is working with the city of Boulder, as well as downtown Boulder, and the Visitors Bureau, to talk about a campaign called Protect Our Herd. So you'll see signs all over Boulder that say Protect Our Herd, because that's the messaging that CU is. So we tried to extend that out into Boulder, and trying to reward people for wearing masks, and to thank them, and to give out CU masks. And so there's a lot of action happening behind the scenes to try to coordinate some of that communications in a way that students will be receptive to. So that's kind of also from the chambers and the economic development authorities type update. Anything else? So that's about CU. So there's I think some people are concerned about CU. Now, will CU's numbers be tracked within the Boulder County numbers, or are they going to be tracked separately?
Yeah, they'll still be part of our population. So when we're showing the information, so we certainly expect with that mass testing happening, again, we know what positivity rates we have in Colorado, and many of these students are coming from other states, and some of those states have much higher rates than what we're seeing here locally. So, but I think CU may be also sharing their specific data. So I don't know if that will be able to be parsed out as easily on our end, but potentially they may have that ability to share.
What I do know is that their data won't be able to break down if it's faculty or students, or if there's a specific outbreak area. But they're trying to find a way to release it at the same time as Boulder County Public Health, so that you're not seeing it in two different times and wondering how it relates. So they're working on coordination in that area as well. Lane, can you go back to, we had a couple people that were a little late. Can you go back to the slide that shows where we are in Boulder County as far as the past 5 days?
The positivity test.
The positivity rate, the 5-day positivity. I think we just had some people that wanted to see it. They're on the call every week, and they wait for you guys to update them, even though they could get that information as well at any point. But I think it's important to see.
Yeah, as soon as it cooperates with me, I will do that.
No problem. I think we're all feeling the effects of some of the kids going back to school with our internets.
Yeah. Can you see that now?
We definitely can, Lane. Thank you.
And, I'll mention, in addition to, what we're tracking here, we are still looking at some of the proactive steps. So we've also tried to do some of that sharing. And I can tell you that from our EPI folks and then the business team that Jesse and I are kind of coordinating, we are seeing that symptom screening has been a massive tool for probably preventing the scale of outbreaks that could happen. So we're seeing maybe much smaller scale, 1 or 2 employees that are identified as ill, and then addressed rather quickly rather than them not being screened and continuing to work and making other employees sick as well as patrons. So that tool has been incredibly effective at really minimizing the impact to businesses and certainly to our community. So just really want to make sure that all those businesses that maybe are feeling some of the pain of continuing to do that screening, that tool has been incredibly valuable and likely been very beneficial for those businesses that have found it early.
And by following the precautions, so wearing masks, social distancing, doing the health checks, staying home if you're sick, a business can limit the exposure that a positive case could have within their confines.
Yeah, absolutely.
And then, just one last point on the CU students, it's, we have a lot of employers on this phone call. And if you're employing students, making sure to express the importance of, what you do outside of work is going to impact the business and it's going to impact the customers and others. So we need to make sure we follow the health precautions as much as possible. All right, so there is a question from a restaurant about whether or not the variances that allow extra patio space will be extended past September. And I just put in a link to the City of Boulder expansion. So they're going to be extending through October 31st. And then other municipalities are also talking about it. So if you're not in the City of Boulder, this link's not going to work for you. You're going to want to check your municipality's sites as far as the extension of that into October. Lynn, do you have anything to add about that? I know there's some talks about, tenting and all that.
Yeah, I know that there is a desire to look at this even longer term so that even into the colder months, having tents and things like that. All those kind of decisions, a lot of those are municipal decisions because they've decided to close off streets and do that. That's not a county decision to be made, but we certainly will work with them and support allowing these businesses to extend, and increase their space. There's just probably some nuances of as they move into tented facilities, those are now more indoor instead of outdoor. So it may impact a little bit, but for the most part, it should still allow them to expand their space.
There were questions about the liquor licensing, whether that was going to be extended because that was coming to a halt, as well as whether or not you can serve alcohol in there. I don't know if that's been resolved, so I would definitely keep checking your city and municipality websites on that piece, because it may be extended to October 31st, but if that statewide measure is not extended, you may not be able to serve alcohol out onto those patios. So I know all the municipalities are really working on it and trying to lobby that gets figured out at the statewide level. All right, so Jesse, you talked about Protect Our Neighbors, and you showed the good news. We have some new people to our calls. What is Protect Our Neighbors?
Sure, that's a great question. Protect Our Neighbors is the next phase of the sort of public health orders. The way it's sort of been set up, we were under stay-at-home during the early phases, and then as we figured out ways to try to minimize risk, the governor created the safer at home and in the vast and great outdoors sort of public health orders that we're under now. And then at the beginning of July, he created the I'm sorry, not at the beginning of July. He created the Protect Our Neighbor phase, which is basically it's the next phase that allows a little bit more density in spaces for communities that have been able to maintain lower levels of infection, lower rates of infection, I'm sorry, and have shown that they have the capacity to handle an outbreak if it were to occur. And we've been building our capacity. We've been, enforcing more. We've been seeing a lot more people wearing masks, and we've seen this reduction in infection rates. And so we're getting closer and closer to that phase where we could apply. And that's the other part of this is, unlike stay at home and safer at home, which the whole state went into whenever the governor put us there, Protect Our Neighbors is an application-based process where we have to show that we meet the criteria set forth by the governor and by CDPHE. And then when they review our application, it takes about 2 weeks. And if we meet that, then, like I said, we can sort of have more people in spaces. It doesn't really change things like the rules about how we have to behave in those spaces. It's more about density.
So we'll still have to do the employee checks. We'll still have to do masking. We'll still have to do social distancing. It just may increase, it may just increase the amount of people that can be in a space at an individual time.
Yeah, and that is very specific to certain types of certain sectors as well. It's not going to be a huge change. And so that's been a lot of the discussion about, if we're operating well and safer at home, is it, what is the benefit of moving to Protect Our Neighbors? We're seeing, there are obviously many businesses that would like to open, but one of the things that I would point out is that Protect Our Neighbors doesn't change the types of businesses that can operate within safer at home or within the public health orders.
You'll still be using the social distancing calculator, correct? So you'll still need, but it may help with a gym that's 30,000 square feet that currently can only have 50 people. It might change some of that,
Exactly.
some of those types of spaces.
That's a good example, yeah.
Okay.
Yeah, it doesn't have as restrictive of space requirements. So the social distancing calculator would probably need to be revised for what the Protect Our Neighbor standards are, because it does start to really encroach on that 6 feet. Again, that's really based on us seeing very low transmission happening in our community. So then we're not as concerned about people, giving it to each other. And that's unlikely to sustain, to be very honest. I think with the arrival of thousands and thousands of new people into our community for the university, plus even schools going back in virtual mode, a lot of kids are going to be in childcare because of the need for the parents. So it'll be unlikely that we see our numbers continue to drop. They're likely to increase.
So one of the things I'll do this week is, again, highlight where you can track numbers, but also highlight where you can track Boulder County's basically how it's following in the Protect Our Neighbors, where they're meeting and where they're not meeting the qualifications, so that you can see even between webinars where we are with the numbers. One of the questions came up is that are these the types of numbers and metrics that influence whether or not a BVSD or a St. Vrain will open schools to in-person after their virtual time that started for St. Vrain just yesterday?
Yes, it's not necessarily just the case numbers, but I think some of the other big challenges for the school districts is looking at the policies that the state has put forth for them. And I think that was one of the bigger drivers of why they moved to virtual was, some of the requirements that the state had put out were going to be really challenging. I think we've also seen a move at the higher ed level that universities that intended to open have seen that it's been incredibly difficult to manage. They're already dealing with outbreaks almost instantaneously. So we'll see how that goes too. But several universities across the country have already, canceled
Yeah.
their efforts and gone to virtual. So
My alma mater, University of North Carolina, Chapel Hill, was the first one to make national news that after a certain amount, they had to close after a week. So I think, just tracking those numbers, seeing the impact of going back to school. Some schools are doing some in person. But I know that both BVSD and St. Brain have said that part of it is what happens when there's an outbreak, what happens, what you do when there's tracing, some of those requirements at the state level that went beyond the numbers. So, yeah. And I want to, at this point, wish all those parents on the call good luck. We're all here for each other as we re-enter this school time and experience that. Do you know if Boulder or some of the other municipalities are ticketing employees or consumers for mask violations, just like Denver?
I don't know quantification. I know Louisville has issued a few tickets since they put their order in place. I'm not really sure how many tickets the city of Boulder has done. That capacity for enforcement is there. For businesses, that's probably something where we're taking more action on businesses whose employees are not wearing masks. We're not jumping straight to enforcement, but certainly if there's continued non-compliance, not putting up the signs, not having your employees wear masks, we're moving those facilities into enforcement. We've worked with them, tried to do education, and it appears like they're just not interested in doing it. So ultimately those facilities could get closed.
And if there's an outbreak, it's not the employee who is in the news, it's the business that makes the news and is reported to the state for the outbreak.
Yeah. And we're not looking to address every instance an employee takes off a mask. We've heard some of those reports where employees have been disciplined because they were in the back room and they took off their mask because, it had been hot for a while, but they were by themselves. That's not an instance where we're going to come out, even if the mask order says you can never take off your mask. We would encourage them to say, hey, tell them to step outside before they take off their mask instead of doing it inside. But clearly that's not the big risk to the public versus the person working at the front counter who's checking everybody out, who's not wearing a mask. That's a whole different scenario. So, but again, we want to make sure businesses understand the risks and are sharing that with their employees, but also setting their employees up for success, giving them breaks, giving them the supplies they need to change masks as they need to. But again, it's you can definitely tell who's trying to make an effort and who's ignoring the regulations.
Okay. So this question came up after the webinar last week, and I got it emailed to me, and I just brought it up for office spaces. So we talked about how under the mask order, no matter how small your office is or what, you need a sign that says "Do not enter without a mask." You can either use the one that we created for Boulder County, or you can use the one that the state has that we've sent out in the links. And I've also put that into the drive with all the signs. Let's say it's a building with lots of suites and lots of offices, and you put it on the outside of your business. Who's responsible for the building? Who's responsible for those common areas within a building?
Without looking at leases and other things like that, my best answer would be everybody should be responsible for that. So there's nothing that would prevent a business from putting something down at the very entry lobby in addition to the very front entrance to their suite. But, ideally that if there's a building manager that's taking care of those common spaces, it would be ideal that maybe they take that on. But I would encourage everyone to have those kind of communications with whoever owns and manages the building and verify that it's happening. So, because certainly those common areas where there's access to elevators or what have you, those are likely bigger areas of congregation than just walking into your, office suite where then you may have a waiting room or something. So, so it is important that it's happening. And ultimately I would just encourage all parties who can facilitate that happening to do that. So.
And each of the business suites, each business needs to have a sign out that says, "Do not enter without a mask." Even if you're not bringing in public, technically your employees aren't related in most cases, and you need to have masks on to enter.
Yes, it's just a pretty simple way to address that. That's one of the things we would ask if we're seeing complaints and problems is do you have a sign up? And so you've already checked that box by doing it.
All right, we're starting to get more and more questions in, and I do have one that's a comment, and I want to just tell that person I will bring it up when we. I'm trying to get through this train of thought, and then I'll talk a little bit about that risk chart. Just let's keep on this mask and employees trend. We know that employees do not count towards the max capacity at special events, but do volunteers for the event count towards that max capacity?
I would consider them as employees, whether you're paying them or not. So it would still fall under that same piece of the staffing that you're using is not counting towards your maximum capacity.
Even if those volunteers are not technically with the facility, they may be with the event organizing group?
Yeah, we wouldn't get, again, there's the line, I guess, of they're volunteering and then suddenly now they're also attendees. That was like their perk was, hey, we need you to work for an hour. Now you get to stay for the last however many more hours. So when they're working, they don't count. When they're not working, they do count.
All right, I think that's an easy way for event planners to think about it. If you're hosting an outdoor movie, most guests are on blankets, socially distanced. If there are people in cars as well, do they count towards the max capacity? So people inside cars and outside cars, do they count together?
That's starting to get into nuances of, is there bathroom access for those people, in cars so that they could get out of the cars? So we would definitely want to review that, but the safest answer is it probably would, unless somehow those people were not ever leaving their vehicles. But again, the potential is if this is an extended event where potentially food is served or there's access to restrooms, we would expect that there's a potential that people are getting out. So we would want to address how you're managing the crowds.
And some of those specific questions would be good to send to the health department just to clarify. And in some cases, if it's an interpretation type, you may ask them to consult an attorney at that point. But those are the types of questions they should email in the in-between weeks, correct?
Yeah, and we've seen different people make some of those different kinds of plans. I think ultimately, especially outdoors, you're looking at 175 people. So that's a lot of folks to manage. So if you suddenly don't count the people in cars and have 175 people on blankets, and then suddenly some of the percentage of the people in the cars are now getting out, you're trying to manage a lot of people, and something's going to go kind of awry.
Okay. With the mask order, if someone wears a face shield instead of a mask, does that comply with the mask order? This person recently saw it at their chiropractic office.
No, those are used in addition to, but face shields really are a different kind of protective equipment. They're really intended to protect that person's face, their eyes, mucous membranes, often from like physical hazards. They're not meant to stop respiratory droplets from the person wearing it from going into the environment. So they don't really do that. It's just really a plastic shield in front of the person's face. So they can be used in addition, but they're not allowed in lieu of.
Okay. All right, so we have someone that commented. So if you want to bring up the risks and benefits, slide number 7. And just note that this is a state of Colorado image. It is something that the CDPHE is sending to the many health departments. The question was if you're ever going to revise that risk benefit slide you show, and I'll qualify for this for you. We have probably a gym owner on the call who says that it seems unfair to continually put gyms in that last category. where air travel is even less risky than going to a gym, especially if people are maintaining social distance and they're wearing masks.
Yeah,
Is there a chance that we could ever revise this and that your decision to represent gyms in this way puts unreasonable fear in the community?
well, I don't know if it's unreasonable. This is data driven. So I think looking again at the outbreaks and the transmission of COVID across the country, gyms were clearly identified as a high risk. I think it's a combination of being indoors and working out, so people are breathing much harder. So that's really where that comes from. This is not something we've created. It's not based on Boulder County data. But I'm not certainly disagreeing that there's a risk of air travel. Most of the airlines are doing screening of every single person that's getting onto a flight. You know, they have to wear a mask the entire time. So again, clearly it's in a high risk category as well. And I don't want to debate one gym over another gym, because I'm sure some gym owners are doing a fantastic job. But it is higher risk when people are in close proximity and breathing really hard. So that's why you see singing, nightclubs, you know, all those kind of activities where people have that potential to project further. And then the more people that you're packing into those spaces.
Well, they say that the research shows that droplets in an exertion or singing can go as far as 25 feet, which is a lot farther than that 6-foot social distancing. I do want to mention that because this is a state image that was sent out to the health departments from the CDPHE, it's not really yours to revise, but we, you know, keeping that in mind, the concerns of the individual on the call, we can qualify it when this comes up.
Yeah.
Sorry.
Absolutely, and I'm happy to look into whether, you know, we will do some research, ask CDPHE about that as well. I definitely understand that this is, since this slide has been around for a while, practices have changed. But again, as Lane said, it's really reflecting the risk of the activity, not the practices of those businesses. And I think that's really important to know.
And you know, for one thing, this isn't something we're marketing to the general public. Our webinars that we're on right now are really targeted to the businesses themselves. Mm-hmm. So this isn't something that we're targeting the general public towards. So it isn't a marketing campaign against these types of businesses and activities.
Right.
You know, we often ask for feedback on these sessions or information, and I think that hearing the concerns. They said, thank you for clarifying, didn't know it was a state slide, and understand the high risk. The state did put it into the daily camera and the and on some of the news sites. So it was promoted by some other people to the public as well. So
yeah, and I think we're all in the same boat of not always appreciating how the state approaches things.
That was a question that came in, was, on previous calls, you said that you made some requests for the mask orders, the statewide mask order. When the governor renewed the statewide mask order, did any of those requests get implemented, or is it same old, same old?
No, none of our requests through the attorneys were implemented. Okay. Yeah, I see another question that came in related to some additional modifications around protective equipment, and there were some changes there. I think we were planning to do that at our next restaurant update, but it's good to just share that now. It doesn't require people working in that retail food service to wear gloves outside of when they normally would for their work activities for food safety, because I think that was a little overkill, making everybody wear gloves all the time. Even for jobs or duties that don't need it. So that was a change. I'm going to stop sharing and find some more.
So just for those people that can't see the question was, with changing research, will requirements change based on that research? For example, removing the glove requirements now that some studies have shown that transmission is less likely through touch.
Yeah. So gloves are no longer required for wait staff. Again, unless they're handling food or something where they would need those gloves which again was as a requirement already in our food regulations. Menus can be reused as long as they are cleaned after each use and can be easily cleaned. So typically you're thinking of laminated menus. Self-service soda machines are allowed, so customers can refill without getting new cups. Again, that touchless option. And then condiments that would be shared or used can be left on tables as long as they are cleaned and disinfected between each sitting. So there's a little bit of sort of relaxation on the retail food side that hopefully may or may not change how people want to approach it. They may be happy with how things are going. I know a lot of places have done virtual menus, especially if they already had them on their websites. So kind of saves you on printing and having to deal with that step of cleaning between uses. So it's up to you whether you want to make some of these changes if things are working well for you and it doesn't feel like you want to upset the apple cart.
Great, thank you for those updates. That's really, that was a restaurant that asked that question, so it's good to have those updates for them. Any other questions before we close out this webinar? All right, I want to thank Elaine and Jesse for joining us and answering these questions. As you can see, we still have lots of questions every week, and I think it's important getting those answered. If you have questions between this different programs that we put on, please ask them. I send out several different ways that you can ask your questions each week. I'll send out the resources that were discussed today to anybody that was on or anybody that's joined us in the past. And I want to thank all our partners at the other chambers and economic development for continuing to drive their businesses to this resource to allow you to get your questions answered, to provide feedback and to get information. And I want to wish all the parents out there good luck as we open schools, in a lot of cases in a virtual manner. So we're all here for each other, and we can all get through this with everything going on. So we will see you next week.
Thanks, Corinne. Thank you, Lane.
Thank you both.
Bye.
Thanks all.
Bye.